So your voice comes from an area in your throat called the larynx, which is also sometimes called our voice box, and it is found in the front of our neck, just superior or above our trachea. Whenever we swallow or speak, we can feel our larynx vibrate or move, which if you hold your fingers up to your throat, you can feel it actively working. So here I have a very simple model of the larynx to help visualize what I'm describing. If I hold it up to my throat like this, it would be positioned like roughly here, just like right above my collarbones. And this is a side view of that. And although this model is very basic, it really captures the most important structures of the larynx. At the superior most part of the model, like the top post part, we have our epiglottis, which flaps down to block our airway whenever we swallow food or fluids. And attached just below that, we have our vocal folds, also known as our vocal cords. These are two bands of tissue demonstrated by these black bands here that allow us to speak. So when air passes through our trachea and through our vocal folds, they vibrate and produce sound. This part of the larynx or vocal folds are particularly sensitive, so sometimes if they are overworked or strained, they can get irritated or inflamed, and that can cause some issues with voice production, like hoarseness, like what you're experiencing. And the vocal folds are attached to these pyramid-like structures here, which are known as the arytenoid cartilages, which are the cartilages primarily responsible for moving the vocal folds. And those are attached to the posterior or the back portion of the cricoid cartilage, which is this ring-shaped cartilage here. It is the topmost part of the trachea. And the cricoid cartilage is attached to the inferior or the bottom horns of the thyroid cartilage, which is the largest cartilage in the larynx. And the anterior-most or frontmost structure of our larynx, with this crease here known as the thyroid notch, often being more commonly known as the Adam's apple. Now, all of these structures that I've demonstrated to you here, they are constantly working together to produce speech. With these little guys here, our vocal folds being the absolute star of the show. As I said before, the vocal folds, they need to vibrate in order for us to speak, and they need to do so very quickly and evenly. So even though we have our arytenoid cartilages here, and we have muscles that adduct and abduct or push and pull those cartilages together, they cannot do so fast enough at a rate that we need in order to speak. So to achieve this, we use alternative methods. So first, tiny muscles will work together to adduct our arytenoid cartilages like so. They're called our adductor muscles, and they push our vocal folds flush together. This completely seals the midline and prevents any air from passing through. And this causes a lot of pressure to build up right below these vocal folds. Air is not able to pass through, so this pressure builds and builds and builds until it eventually reaches a threshold that forces the vocal folds and the arytenoid cartilages open. And that lets the air pass through before they quickly shut once again. And this happens because the vocal folds are elastic. So just like when you stretch a rubber band, they will return back to their original position after being forced open by the built-up pressure. Additionally, the release of this pressure from below the vocal folds creates a sort of suction that forces the vocal folds back closed. That's what that snapping shut I was referring to was. This allows the pressure to build up right beneath the vocal folds once again. This is a process known as myoelastic theory. So while you are speaking, this cycle of pressure building, opening, snapping shut, repeats hundreds of times per second, and that creates the vibrations that we need in order to speak. So now, with all that being said, it might go without saying that it is very important that your vocal folds properly seal at the midline like so, in order to enable that pressure building process to allow the vocal folds to properly vibrate. So when we took a look at your vocal folds, we found what appears to be nodules right at the midline of your vocal folds on either side, which directly obstructs that seal. So these nodules prevent the vocal folds from closing completely, which ultimately does not allow them to vibrate properly against one another while you're speaking, which is likely why your voice quality has become hoarse, especially by the end of the day when your vocal folds are probably at peak irritation from the nodules just rubbing against one another all day. So if you're having to raise your voice or talk in a sort of like cheery tone like this at work, then that can cause a lot of tension on your vocal folds because it would cause the thyroid cartilage to go downward and your larynx to move, which stretches the vocal folds and makes them less elastic. It puts a lot of strain and tension on them, and that can eventually lead your vocal folds to developing nodules like this. So if you thoroughly rest your voice by minimizing talking, especially not yelling, drinking lots of water, avoiding irritants like smoking and spicy food, just general vocal hygiene like that, then in about a week or so you should see a lot of improvements in your speaking condition. It's very important that you take care of your vocal folds in that way to allow them to rest. However, if the issue continues to persist, then please do not hesitate to reach out and come see me once again. Thanks.